can we trust pilots? What's going on with pilots? What's going on with the mental health of pilots right now? The state of the mental health of the aviation industry. Why is mental health shrouded in silence and is often shamed and seen as a weakness in our society? That's not right. We need to start the conversation. We have to start the dialogue so that we can find ways to help people who are affected by mental health. Stay tuned to the end, and I'll reveal my toolkit and resources for mental health so that you or someone that you know that is affected by mental health can get the help that they need. Today, I'll be diving deep into a subject that touches all of our lives, but yet remains shrouded in silence. And that topic is mental health. So let's start with the basics. What is mental health? Mental health isn't just the absence of mental illness. It's about balance in our thoughts, emotions, and behaviors. It's the sweet spot where we feel resilient and can manage normal life stress and can make meaningful contributions to our community. And it's important to understand that mental health is a spectrum, and we slide up and down that spectrum throughout our lives. I'm gonna get into the importance of mental health. Before I do that, I wanna get into the importance of you hitting that subscribe button. Turn on all your post notifications so I can continue to bring this content. Why should we care about mental health? We should care about mental health because it's fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life. On this journey we call life, our mental health is like the engine powering us through. And here are some stats to show you just how important mental health is and why we need to start the conversation. Nearly 50 million of American adults experience mental illness. 5% of adults report having serious thoughts of suicide, and this has increased every year. 25% of adults with mental illness report an unmet need for treatment. This number has not declined. Kids are not immune either. In fact, many mental health cases and illnesses start at adolescence. 15% of youth experience a major depressive episode in the past year. Over 60% of youth with major depression do not receive any mental health treatment. Either they can't afford it or they're just not getting adequate coverage. More than half of adults with mental illness do not receive treatment, totaling over 27 million adults. And roughly 11% of Americans with a mental illness are uninsured, the second year in a row that this indicator since the passage of the Affordable Care Act. 8% of children had private insurance that did not cover mental health services. Pilots. The life of pilots can be very hectic, can be very busy at times, especially during the holiday season. This type of lifestyle leads to erratic schedules, adapting to multiple different time zones, lack of sleep, and being tired. There's no secret why you see all those pilots in the pilot lounge. Sickness, because you're not eating right, not really taking care of yourself, you're not sleeping right, you're always on the go. Wears on your body. Anxiety due to regular testing. Every year you have to get requalified in order to fly that aircraft and in order to keep your job. That is directly tied to your livelihood. So there's a lot of stress involved with that. Insecure job. Hey, I've had airline pilots tell me, mentors of mine tell me, hey, at some point in time, you're going to have to expect to be furloughed at some point in your career. And that has to be weighing on everybody's mind. This job is not really, secure all the way, because at some point, the economy might take a turn for the worse and airlines might furlough pilots. Work-life balance, whatever that's supposed to mean. Something's gonna suffer. Either you're going to be paying more attention to family and work is going to suffer, or you're going to have to dedicate more time and energy to work and family's going to have to lose out on the minds of pilots. And this definitely plays into the mental health of pilots. Adapting to constant changes in the industry, strain on personal and social relationships, and financial issues. And here's some other interesting psychological factors, behavior factors, and physiological factors that tie into a pilot's overall mental health. On average, most pilots get about 7 hours of sleep. Then you've got 22% that get about less than 6 hours of sleep. And 21% have developed sleep apnea risk. Because of the busy lifestyle, 52% have insufficient physical activity. A whole lot of pilots working out. 68% insufficient fruits and vegetable intake. 9% are actually out smoking. 52% consume alcohol regularly. 28% are at risk for hypertension. 77% have experienced elevated fatigue because of very demanding schedules due to the looming pilot shortage. 21% experience mild depression. 6% experience mild anxiety. 24% poor to fair self-rated health. 47% of pilots are overweight. 12% are obese. And 59% are either overweight or obese. And these are all factors that play into a pilot's overall mental well-being. So, how can we maintain our mental health? Picture your mental health like a garden. It needs to be tended to regularly. That means nourishing your body with exercise and nutritious foods, connecting with others, and practicing stress reduction techniques like meditation. And remember, it's not about just coping with the bad days. It's about creating a toolkit that helps you live your best life every day. And one way that you can do that is with a support system. Build your support system. Find someone such as a parent, family member, teacher, faith leader, healthcare provider, or other trusted individual. Someone who gives good advice when you ask, assists you in taking actions that will help, and is someone you like, respect, and trust too. Allows you the space to change, grow, make decisions, and even make mistakes. Listens to you and shares with you both the good and the bad times. Respects your need for confidentiality so you can tell them anything. Lets you freely express and validate your feelings and emotions without judging, teasing, or criticizing you. Works with you to figure out what to do next time a difficult situation comes up. Has your best interest in mind. Now, since you've made it this far in the show, I'm going to reveal my mental health toolkit that can help you or someone you know experiencing a mental health crisis. If you are experiencing or someone you know is experiencing a mental health crisis, call or text 988. The 988 Lifeline provides 24/7 free and confidential support for people in distress. The 988 Lifeline is a resource provided by the Substance Abuse and Mental Health Services Administration. I'll have all of their phone numbers and the links to their website in the description below. And this is not a paid advertisement. I have no affiliation with this organization whatsoever. I just want to be a resource for whoever's watching this video to get the help that they need. We covered a lot today, and I hope it provides some spark for introspection and conversation. Mental health is a journey. It's not a destination. Mental health is not a weakness. Admitting it, speaking up about it, doesn't make you weak either. It's time that we stop treating this subject as something taboo. And I like what Delta Airlines is doing. Delta Airlines is taking a stand, and they're getting out ahead of this thing. And I like what Delta Airlines is doing. Delta Airlines has a program in place for pilots who have mental health issues. And I could see where there would be concern for someone who's actively flying for an airline to say that they have mental health issues and come out with that, because there's a negative stigma attached to that. There's a negative stigma attached to having mental health, mental illness. No one really wants to be on an airplane with a pilot who's having some mental health problems. But we got to start the conversation. We have to have programs in place for people that have this to get the help that they need. They shouldn't be shamed for it, shouldn't be looked down upon. But that's the society that we live in today. Mental health is a nationwide issue. And we would be naive to think that pilots are immune to having mental illness. So we need more programs in place, just like the one that Delta Airlines is implementing to help their pilots out nationwide, industry-wide. Because if we don't, how many more pilots are going to self-medicate with shrooms, ride the jump seat, and just mid-flight up and try to pull the T-handles and shut down the engines in flight? How many FFD approved pilots, certified pilots to carry firearms on these aircraft? Okay, they've been vetted, they've gone through the training, and they carry firearms onto the aircraft that they fly. How many more instances do we need for a pilot to have a mental episode in flight and threaten to shoot the captain? How many more pilots, who've been demoted or something happened with their career, and now they're no longer captain, or they're having to fly as first officer, and they decide to just end it all with everybody on board? How many more times do we need to have things like this happen before we have the conversation and we start putting the programs in place to help people out? You tell me. Get down in the comments section. Let me know your thoughts. And if you like this video, I'm pretty sure you'll like this one right here. Yeah, this video right there. Go ahead, click that video.